Today we will discuss about thoracic aorta and its branches. As we all know that when the aorta comes out from the left ventricle, it forms the ascending aorta, then arch of aorta. Then when it comes down, it forms the descending aorta. The descending aorta we differentiate into it on its position in the thorax and abdomen into the thoracic aorta and into the abdominal aorta. So we will discuss the thoracic aorta and its branches. Thoracic aorta has two branches. One is visceral and other is parietal branches. Visceral branches has further four branches. Parietal has further three branches. The visceral branches of thoracic aorta. First is the pericardial branch. Is known from the name that pericardial means it from the it will supply to the pericardium of the heart. So what is pericardium? It's the outer covering of the heart that protects the heart from injury. It also has pericardial fluid which protect it from the friction when the heart contract and relax. So pericardial branch will supply to the posterior surface of the pericardium. It comes out from the thoracic aorta. It is the direct branch of the thoracic aorta. The other branch is the mediastinal branch. As the name consider as we can understand it from the name, as the name shows that mediastinal branch will supply to the mediastinum. Okay, which mediastinum? There are superior mediastinum, middle mediastinum, interior, posterior mediastinum, inferior mediastinum. So which will it supply to, which mediastinum will it supply to? Mediastinal branch will supply to the posterior mediastinum. On which content will it supply in the posterior mediastinum? It is the lymph nodes and the areolar tissue, the posterior mediastinum. Lymph nodes and posterior and areolar tissue, the posterior mediastinum. Which artery will supply? It will the mediastinal branch of the thoracic aorta, direct branch of the thoracic aorta. So other branch is the two left bronchial artery. Two left bronchial artery. One is the upper bronchial artery, upper left bronchial artery. The other is the lower left bronchial artery. It will supply to the left lung. The other lung will to the right lung. It will that branches will supply from the other part of the aorta. So the thoracic aorta only supply to the left lung. So which two branches? Two left branches. Upper left bronchial artery and lower left bronchial artery will supply to the left lung. Other branch is the esophageal branch. Esophageal branch, as esophagus is a long tube, so its lower third branch will supply esophageal branch will supply to the lower third part of the esophagus. So these are the four branches. Pericardial branch will supply to the posterior surface of the pericardium. Mediastinal branch will supply to the lymph nodes and areolar tissue of the posterior mediastinum. Two left bronchial artery. One is the upper left bronchial artery and the other is the lower left bronchial artery. It will supply to the left lung. In esophageal artery, it will supply to the lower third of the esophagus. So it was the visceral branches, four visceral branches. So now we will consider the three parietal branches of the thoracic aorta. So it has the first is the 9 posterior intercostal arteries. As we all know, there are 11 intercostal spaces. So 11 intercostal spaces, and it has 11 intercostal and it has 11 intercostal arteries and 12 subcostal arteries. So the 11 intercostal, when we consider it as 1 2 1 and 2, we if we don't consider 1 and 2, so from 3 to onward 11 there are 3 to 11 intercostal artery. The 9 posterior intercostal artery will supply on each side. It will these 9 posterior intercostal arteries will be coming out from the thoracic aorta on the parietal branches. So when we there are 11 intercostal arteries, one subcostal artery. So the 12th costal artery, which is a subcostal artery, will come out from the also from the thoracic aorta. So the other is the superior phrenic artery on the each side. So these are the branches: 9 posterior intercostal arteries, subcostal artery on each side, and superior